We all know the world is in the middle of a massive mental health crisis, but what if the solution isn't just about hiring more therapists? What if it's about a whole new kind of therapy? Today we're diving into a new model that actually teams up artificial intelligence with human experts to deliver care in a way that's never been done before. Let's see how it all works. So to really get a handle on this, let's look at this number, 970 million. 970 million people around the globe in 2019 lived with a mental health condition. Think about that. That's almost 1 in 8 people on the entire planet. Staggering. And this isn't just a personal struggle, it has a massive economic footprint. Just depression and anxiety alone are estimated to cost the global economy around $1 trillion every single year. And that's mostly from lost productivity. It's a cost that one way or another really affects us all. So, the big question is, why is the current system struggling so much to keep up? Well, this gets to the core of the issue. Traditional mental health care, for all the good it does, is just completely overwhelmed. Well, it boils down to 3 huge challenges. First up, there's access. Millions can't get help when and where they need it. Where you live, how much you make, and just the stigma around it all create these giant walls. Then you've got capacity. The reality is there aren't enough human therapists to go around, which leads to these crazy long wait lists. And finally, consistency. Care is usually just 1 hour a week, maybe even less, leaving people to fend for themselves in the gaps between appointments. To tackle these exact problems, a new hybrid model is starting to emerge. Aim High's AI human model. Let's take a look at the Aim High platform, which puts forward a hybrid solution, basically combining the best of what AI can do with what humans do best. What exactly is Aim High? It stands for Artificial Intelligence Mental Health Initiative. But hold on, this isn't just another chatbot you download from an app store. It's a platform where you get 24/7 AI conversation support, while licensed human therapists are supervising the whole thing in the background. That human supervision, that's the secret sauce. It's the absolute game changer here. When you put it side by side with the old way of doing things, the difference is night and day. You go from being stuck with 9 to 5 office hours to having always-on support. The idea is to shrink those wait lists, fill in those empty spaces between appointments, and give clinicians a tool that actually helps them, instead of just adding to their pile of work. To be clear, Aim High isn't the only player in the digital mental health space. You might have heard of other apps like Wobot or Wiser, which are great as AI coaches or wellness buddies. But this is a different beast entirely. It's built from the ground up to integrate into clinical care, and it's all about that continuous, real-time human oversight. That one detail changes the entire conversation. Okay, I know what you're thinking, AI and mental health. That immediately brings up huge questions about safety. How does a model like this even work responsibly? Well, it all comes down to a framework built around human control. It all comes down to this core idea of human in the loop. What that really means is that the AI is never just off on its own. A real qualified human therapist can always see what's going on, making sure the care is always grounded in actual clinical expertise. Here's where that really matters in a crisis situation. Let's talk through it. Step 1. The AI picks up on some keyword or some signal of distress. Step 2. The system instantly flags that conversation. Step 3. A human therapist gets an alert in real time. And step 4, that therapists can jump in and take over immediately. It's a built-in safety net, and that's something that most standalone. It's a built-in safety net, and that's something that most standalone AI bots just don't have. And this really gets to the heart of it. The goal here isn't to replace therapists, it's to empower them. Rather than a standalone chatbot, Aim High serves as a force multiplier for therapists. It's a tool that can handle the routine check-ins, freeing up clinicians to focus their skills where they are truly needed the most. We can break this down into 4 key pillars. First, transparency. Users know they are interacting with an AI. Second, strict privacy. All data is locked down under rules like HIPAA and GDPR. Third, scope. AI does not diagnose or make critical care decisions. Period. It's a support tool. It doesn't diagnose anything. And finally, and this is the big one, accountability. A human clinician is always responsible for the patient's care. So, safety and ethics are covered, but what does this actually do for people in the real world? Let's talk about the tangible impacts this has on both the patients and the clinicians working so hard to support them. Probably the biggest thing it does is throw the front door to getting help wide open. Think about it. It gives you support after 5 p.m. when everything else is closed. It can help people in rural areas that might not have a therapist for miles. It can offer immediate support to start chipping away at those wait lists. And for some, it might lower the stigma as it feels like a less intimidating first step. And for the therapists themselves, this is a total workflow revolution. The numbers suggest the AI can handle something like 80% of the routine, day-to-day check-ins and support conversations. And that frees up the human therapist to pour their time and energy into that critical 20% of complex cases that absolutely require their direct expertise. So what does that actually mean for a therapist on the ground? It's a double win. First, they can potentially help more people, expanding their reach without burning out. And second, with features like AI-generated session summaries, they can slash the time they spend on paperwork, which, let's be honest, is a huge reason for burnout in the first place. This gets them back focusing on patient care. At the end of the day, what we're talking about here is a massive shift in thinking. We're moving away from this idea that mental health care is something that you get in these little spaced-out appointments. Instead, it becomes this continuous proactive thing. It's about shifting care from being reactive to constantly managed, just like you would with any other chronic health condition. And that really brings us to the final big question. With models like this starting to take shape, we're seeing a future where care isn't just about one person in a room. It might be about a collaborative team, human and an AI working together. The question is, what would that future of therapy look like for all of us? Aim high, scaling and democratizing, mental health care for all.